Yeah. Good evening, everyone. Thank you, Hemanti, for including me in your session course. I have no financial you in this course. The guidelines we are going to introduce in this course are the AIS guidelines, and you can quote these guidelines in any court of law. Next slide. As we all know, this is the dreaded condition which we all do not want to happen in our hospital, but it is not in our hands. There are 5 possible factors alone or in combination which can help us in preventing this dreaded disease. Number 1, patient personal hygiene. Number 2, contaminated surgical supplies. Number 3, faulty installation procedures. Number 4, inadvertent touch. And number 5, environment. If we take care of these 5 possible factors, we can control the infection and we can have zero endophthalmitis in our hospital. What are the preoperative risk factors? Number 1, we should meticulous external eye examination should be done on slit lamp before the surgery. And we should see for blepharitis, conjunctivitis, lacrimal duct obstruction, ocular prosthesis for the fellow eye, any infection in the other eye, eyelid abnormalities, and most important is the diabetes. We should operate only when the diabetes is under control. What are the investigations? These parameters are the AIS parameters, and we can quote in the law, court of law. We can speak. Blood sugar, it should be less than 120, and random blood sugar less than 200 milligram per cent. Conjunctival culture should not be taken in all cases, but in chronic infection, we can take it. During routine microscopic, if patient diabetic or other systemic disease are there. Syringing not as a routine, but if you have to do, you should not do on the same day. If regurgitation is there, then surgery should be postponed. What are preoperative medications and indication for the patients? 4th generation broad spectrum antibiotic, 4 to 6 times a day before surgery, and on date of surgery is recommended. Patient should come with proper face wash, hair wash with soap, beard should shave properly. Please, they should clean all the area around the eye, and they should wear the clean clothes. What should be the restriction to the staff? If biometry has to be done on the same day, use immersion method, and do not use the contact method to avoid contamination. If you have long list of cataract surgery, the diabetic patient should be given preference in OT list. Preoperative preparations, when the patient is on the table, your assistant should be advised or instructed to clear the brow region and lid margin with 10% iodine solution. Most important is the povidone iodine 5% 2 times topically and minutes before surgery. This is the most important. Even if you have, oh my God.
I think sir has lost connection. So should we wait for sir or maybe go to the next topic?
We can go to next topic when sir
joins again,
then we can complete from here preoperative.
Okay. Okay, that will. Or should I call up sir once?
Basic problem is in UP and Uttarakhand there is heavy rain.
Okay.
That's why.
Oh.
Okay, maybe I'll just give a call to sir and then we'll confirm. Okay.
Sure.
In the meantime, I think Deepak, for the audience, we could discuss a little bit about TAS.
Sure, sir.
Yeah, that can be done. Yeah.
Yeah, I think till so maybe
Sir,
No, I am also not getting his number. The line is telling it's busy.
So we can move to second speaker, I think.
I think
Okay.
it's better.
That is one.
Okay, so the next talk is by me.
Can I?
Come back.
Oh,
Sorry.
sir has
Yes,
come.
sir. Yes, sir.
Okay,
Sorry.
okay, sir.
So you can continue the slide. Sorry for the disturbance.
Yeah, yeah. No problem. I'm giving. Yes.
So the povidone iodine 5% 2 times topically 5 minutes before surgery is more important even before using broad spectrum antibiotic 1 day before surgery. This is very, very important point. Then we should change the street clothes to OT clothes, mandatory for patient, staff, and doctors. And if the patient, if we have doctor assistant, should be avoided using tuckling and all here. We should properly use the caps. Mask disposable, especially in the corona time, we should use the new mask in the OT for the patient, for the staff, and for the doctors. Then we should change the sleepers properly in the OT. Gloves should be changed after each case. Gown should be changed after 5 to 6 cases. And we should, OT team and all the members should be have no infection, URT, eye infection, or skin infection on the day of surgery. We should not allow anybody with this infection in the OT. Scrubbing should be done properly by chlorhexidine or antiseptic soap up to the elbow. And we should use iodine liquid scrub. And this type of chart should be hanged over the scrub area, not for you, but for the staff to aware that they have to do the scrubbing for 5 minutes. Next. Use proper technique of gloves. You should know, we all know it. We should glove proper technique. Next. Draping is very important to prevent any infection from the eyelash or the lid area. It is very important, and we should not trimming the lashes is not required nowadays. Next. This is very important. We should check expiry date and packing whether it is intact of all the supplies used intracamerally. Next. Irrigating fruits. It is the most culprit in the cataract surgery, and most of the time we have seen this has caused the endophthalmitis. So note the batch number, physical inspection against light for any particles, preferably one bottle for one patient and no double autoclaving is required. Keep infusion bottle for 24 hours after use. If there is an infection, you can do the culture for this. And microbiological workup and approval for each bottle if it is possible at your place. Next slide. Phaco sleeve and tip should be changed after each case. There is no evidence that using antibiotic in irrigating fluid helps in preventing infection, so it should be avoided. Subcutaneous antibiotic given at the conclusion of the surgery have been found to reduce risk of endophthalmitis. Intracameral injection and watertight cordial incision important when in doubt. And if they are PCR, we should manage complication very effectively. Next slide, please. Post-operative, we ask the patient to come first day, 7th day, and 15th day, and then as and when required. Examination on set time very important, and the frequent visits. We give normally topical broad spectrum antibiotic for 7 days, orally only in high risk cases, and topical steroids 15 to 21 days in tapering dose. Painkiller, SOS, and protetic glass given for 7 days. In case of doubt of infection, talk to the patient and relative in advance. Institute prompt appropriate treatment and do not panic. And if you're working institute, inform your higher authorities. Next. Microscope head, phaco, corti, this all be you will taught in the next lecture. Should be cleaned properly in the OT. Next. This is OT layout will be told to you by the next speaker, but most important is the thick water tank. We should clean the water tank frequently, rapidly every month, and we should note down in our record. Next slide, please. This is a checklist, daily checklist. We should, I will take 30 minutes, second more. But in the OT area, and we should check this OT list frequently. Who checked the pre-operative checklist? Who checked the autoclave strip register? Who filled the drum? Who checked daily injection expiry date? Who did the prevention before awareness of the surgeon preparation? These all things should be maintained in the list form in your outside your OT area. Next slide, please. Who did the cleaning, mopping before leaving the evening the OT? Who did put the UV light on if it's there? Who checked anesthesia trolley? This everything should be mentioned outside your OT area so that your staff knows it. Next slide, please. And should be signed by OT in charge daily. Then there are these weekly checklists, list of medicine checked, expiry date especially. This is OT checklist. Then who submitted autoclave reports. This should be shared every week, should be signed by your staff nurse and should be signed by you also. This help in keeping your staff aware that the doctor is going to check it and they will be on the toes every time. Who cleaned the OT wall? Who cleaned the sink? This everything should be mentioned in there. Next slide, please. And who cleaned the AC filters? Who cleaned the instruments clean? This everything should be mentioned in this weekly list. Next slide, please. And expiry date of medicine, who checked, where the operating microscope lens is clean. This note should be signed by the OT in charge and then by the HOD. Next slide, please. Monthly checklist, you should have swab culture every month. Who had the OT assistant cleaned by air blower? Didn't check the washing the OT. IOL stock check. This should be a monthly check, and this should be signed by the HOD and by the concerned person in the OT. Next slide, please. Drum clean. Who cleaned the drum? Who cleaned the window, door, the storage shelf? Who cleaned? Everything should be mentioned and signed by the OT staff and the doctor. This will help in preventing an thunderous because your staff, your doctors will be on the toes. They know what to do, how to do. Next slide, please. If you take all these things, next day patient will be happy and will be saying thank you to you. So thanks a lot for patient's hearing. Thank you.